And we're going to switch gears now, as we do every Friday morning at this time, to the COVID-19. Now, it's been a year, and Dr. Kevin Kavanagh joins us now. Kevin is a retired physician, also founded an organization that has just taken off. It's nationwide, called Health Watch USA. Dr. K is what we call him. Dr. K, did you think a year ago that we'd still be here doing this all the time?
I was scared of it, Jack. I'll be honest with you. I remember when we started, you said you'd have me on for about 2 weeks. And I almost said, well, it might be 2 years, but I didn't. I compromised and said a couple of months.
Okay. All right.
Pandemics usually take a while to go away. And so a full year being into this really isn't that surprising. What is surprising to me is that we have an effective vaccine so quickly. And that is just tremendous news. I mean, I can't tell you what a groundbreaking scientific breakthrough that is. But it's also disheartening that so many people aren't getting the vaccine or are hesitant in getting the vaccine. And really, for us to beat this pandemic, we need to get everybody vaccinated who can receive a vaccine. That is absolutely essential.
You got some Kentucky facts and figures for us?
Well, Kentucky really looks great. Our cases are dropping, our ICU rates dropping, the number of ventilators that are being dedicated for COVID patients is way down, over 80%. Test positivity rate is below 3%. So, Jack, I mean, in Kentucky, we've done things correctly. Things are looking great. We do have some cautionary signs when you look at Michigan or you look at New York, even Massachusetts, rates are going up. And this, to me, is very disturbing in New York because, as you know, they have their own homegrown variant, and they were the area that everybody was, well, not me, but almost everybody was saying, well, they've been decimated by this virus. They've probably reached herd immunity. And so I think that we need to be careful of reinfections with this new variant that we're seeing out in New York. It will spread, but vaccines give good protection as far as from severe disease, hospitalizations, and deaths. And that's why we need to get vaccinated. We have in our armamentarium the tools to avoid any severely adverse types of outcomes from these variants. So let's get vaccinated.
Here's a question from Bill. You don't know this, but you will be participating, Dr. K. We just haven't asked you yet, but we're going to have a whole day of nothing but COVID-19 on April the 7th. That's a Wednesday from 9 a.m. to 6 p.m. We're going to do nothing but talk about looking at the year previous and the year ahead with experts. And Bill asked, will Dr. K be participating in the COVID-19 after the long lockdown day-long broadcast on April the 7th? And if you will, sir, and we'll get specific on time, will you participate? I hope you will.
Well, sure, I'll be happy to.
All right, good. That's on a Wednesday. It's a week from let's see, next Wednesday, a week after that. Call waiting here, and this is Andrew. Good morning. You're on with Dr. K, Andrew.
Good morning, Jack. Good morning, Dr. K. How are you this morning?
Doing very well, very well.
So the reason I call is to kind of maybe give you an insight as to why people are, or at least for me, why people are a little bit hesitant on the vaccine. I think that the climate of our trust in government officials is so poor that it's kind of like, you know, yeah, okay, the government says it's safe, the health officials say it's safe, but people have been lied to for so long and for so many generations. You look back in the day where the African American community were not treated properly for syphilis, and just do research and find out why, what the long-lasting effects were. And it's just kind of a general distrust in government and big pharma and institutional I don't want to be. I don't want to see in 10 years that commercial on Saturday morning. If you got the COVID vaccine and you're experiencing issues, call this number and join this lawsuit. You may be owed damages.
Let me do this real quick. Hey, wait just a second, Kevin. I'm going to let you hang up and listen to the answer because your line is very, very noisy. So you go ahead and hang up, listen to the answer on the air. Okay, Kevin.
Yeah, I know that history, and it is just horrendous, but this is really different. This is a worldwide effort. It's not just in the United States. It's not politicized in other parts of the world like it is in the United States. And even independent scientists, for example, Dr. Osterholm, who is certainly not one of the insiders of government, is advocating for you to get the vaccine. One of the individuals that is very much an advisor to Health Watch and has participated in almost all of our conferences is Dr. Jocelyn Elders, past Surgeon General. And she is advising people to get the vaccine, and she's received the vaccine herself. I've received the vaccine. So it's not similar to withholding treatment and seeing what's happened. It is getting the vaccine and getting treatment. I think if you don't get the vaccine, we're going to see a lot of studies in the future of what happens to the people who didn't get it. So yes, we are kind of studying this as we go, and that's something that's important for people to realize. They're continuing to collect quality data. They have now over 6 months of quality data on the vaccines that are present in the United States. And that is good. And everything right now looks like it gives great benefit with relatively small risks. And just look at the scrutiny that the AstraZeneca Oxford vaccine is going through. Now, granted, it's not good to have all of these questions about data and research that has occurred with that vaccine, but it shows you that NIH and our vaccine safety committees are looking at data very, very carefully, and it's not a for sure pass of getting approval in the United States. So please get the vaccine.
We take these calls in the order that we receive them, and this is Robert. Hey, Robert, good morning. You're on with Dr. K.
Good morning. I had a question about with this virus, and I know there's other viruses too. We know this was in the lab in China, and it could be in other labs. I guess they study these things, but is there no way of trying to tell the effects of these and try to have a vaccine for when or if something like this were to get out?
Well, yes, they have been studying these viruses for some time now, for over a decade. That's one of the reasons why the vaccine came out so quickly. They've been working on this. And it's virtually impossible to tell if the virus actually came out of the lab or came out of nature, because this type of virus was being studied by a lot of labs around the nations. And to be honest with you, a lot of the studies that are published were multinational, with China, United States, Europe, etc., joining together, trying to figure out how to stop the next coronavirus pandemic. Remember, we had MERS, we had SARS, and so this is just another pandemic caused by a coronavirus. Unfortunately, it is much more lethal than the others as far as infectivity and spread. And that's one of the reasons why we really do need to get vaccinated. So let's take advantage of this research and try to mitigate the effects of this virus.
All right. Thank you.
All right.
Yeah.
And to another phone line we go. This is Rose. Hey, Rose. Good morning.
Good morning. How are you?
Good.
Very good.
I have a quick question concerning the vaccine safety, and I just wonder, is it true that these pharmaceutical companies are not held liable for any problems with their vaccines?
I'm really not sure about that, But under an emergency use authorization, I'm sure that there are different rules than when it is fully authorized and approved by the FDA. But right now, things look very good as far as safety goes. Certainly, I would think gross negligence, such as misrepresentation of data, which is being submitted to the FDA, would be something that they could be held liable for. But when you submit data in good faith, the data is accurate from what you've observed, and people are overall receiving a benefit of it, there may be some protections there. So I may not be the best person to ask that question, but I wouldn't be surprised if there isn't some protection when you start using a vaccine under an emergency use authorization.
Yeah. Does that help?
Yes, thank you.
Okay. Now we're just about out of time. We have a new producer of this program, Lane Haslock, Kevin. And Lane, I think you have a couple of questions.
I sure do. You mentioned about how well Kentucky is responding to this virus. And my question is about the senior living centers that they've done a really good job trying to protect, the residents and their staff. But I hear that some of them are starting to, allow visits and things like that, and that just concerns me. So I wondered how you would advise the senior living centers in town.
I would advise that only vaccinated people be allowed to come into the center. I think that the current CMS regulations or recommendations are not adequate to protect safety. Remember, CMS is an insurance arm of the United States government. This is not the CDC, and I've written articles on their recommendations, and I think that they are too lax. So I would only limit this to people who are vaccinated. I try to keep this in an area of the facility where other residents aren't exposed to those individuals, and to make sure that you have excellent ventilation in that area. Because remember, with these new variants, it is highly likely that you'll be able to become infected and spread the virus, even though you don't become severely sick. And I think we'll be seeing these new variants shortly in Kentucky.
A text real quick before we run out of time. Is it safe to get the vaccine if you have had COVID and still have the antibodies?
The answer to that is yes, but you need to wait a certain amount of time, and I would consult your doctor regarding that. The last I heard is at least 3 months. The reason is that the vaccination will give you 6.5 to almost 10 times the antibody levels that you would get from a normal infection. And that is what you need to ward off some of these variants.
All right. Thank you, Dr. Kevin Kavanagh. Stay with us. Update from the Information Center next. Have a great weekend, and we'll be back on the air.
Art engages all of our senses, but it's in the intersection.